It's
that's a good point. I think that's why the kids in Japan changing. They don't sit on the floor.
They're starting to sit on like chairs.
That's why their mobility is so
low.
Much lower than our age.
Yes, and I think that's something to take into note. That's a cultural influence, because they're maybe picking up Western culture or whatever it is, but it affects daily movement. And when you start to do that, you're getting all those problems like we talked about, and then maybe leading into health issues or overweight issues. Today, I'm really excited to bring this episode to you guys, and I have my first guest, Dr. Takeshi Suzuki, who is originally from Japan, but he has a wealth of experience and knowledge working with high-level athletes and also the general population. His background is he's an athletic trainer, certified athletic trainer in the US from Washington State University, and he went on to go back to Japan, and he worked with a lot of the winter athletes, specifically skiing athletes on the Japanese Olympic team, and he has a wealth of experience in that realm. He's been with the Japanese Olympic team, he's been to the Olympic Games at Salt Lake City, Turin, Vancouver, Sochi. He is still to this day on the Japanese Olympic Committee Medical Advisory Board, and he will be in that position when the Olympics go to Tokyo in 2020, just a few months away now. He is the owner of Our Body Project, which he founded in 2003, which you will hear us talk about today. And he currently has 3 locations in the Tokyo area, and they cater to everything from elite level athletes to the general public, really focusing on teaching proper movement, teaching people how to exercise, and elevating their performance. It's a very similar setup and philosophy to what I do in the clinic at Performance Rehab Ortho, and we are going to discuss that. In 2011, he created the Our Body Academy, which is designed to educate and train future experts in strength and conditioning, exercise, science, and just training in general. And he has done a really great job training all of his employees and also other people that have come through his seminars and workshops in Japan. He also gives a lot of seminars, workshops, and presentations outside of Japan, and he's been to many different countries, and he's even presented here in Hawaii at one of our strength clinics. I am very grateful to have had this opportunity to sit down and talk with Takeshi. He's an extremely busy person, but every time he comes and stops in Hawaii, he always makes sure to come and visit me and come and visit Performance Rehab Ortho. And we just have good discussions about some of the things he's doing and some of the things that I'm doing. So this time we decided to record it on my very first guest on my podcast so that you guys can hear some of the discussions that we have behind the scenes. And I can't wait to share this interview with you. I hope you guys all enjoy. And we are going to talk about how cultural influences from Japan and the US influence how people perform, how they take care of their body, and what kinds of obstacles we have to overcome when dealing with some of these cultural influences. Enjoy. Okay, so we have Takeshi here all the way from Japan. And every time we have good conversation, and it's very good to talk to you again. You make these short trips and always come to visit us at the facility and share some of the things that you're working on. So, thank you for joining me and everything.
Thank you.
Yeah.
Thank you, Andrew.
And today, it's kind of an interesting conversation because I think across the world, there's a lot of similarities when it comes to training and performance training and even rehabilitation. Yeah. But there's also a lot of differences because of the different environment or different cultural aspects. And that's something that I wanted to touch base on with you today. And that's kind of the topic, is some of the cultural influences when it comes to optimizing your performance. So first off, as you guys heard from the introduction, you have become very successful making this Our Body project. And you have 3 facilities, right? As of right now. Yeah. So can you explain to people that are not so familiar with Our Body Project what that is, kind of the history of Our Body Project, and what made you start that?
Okay. My name is Takeshi Suzuki. Everybody call me Tak. Then I'm Japanese, but I went to school in the Washington State and get a certification, ATC, there. So my background is like sports medicine and athletic training.
Yeah.
But with that experience, I came back to Japan. Then I tried to work as athletic trainer. The first of all, I've been taking. I take care of like a national professional sport team first. That was okay.
Yeah.
It's that things. It's almost similar things in the U.S.
Yes.
Yeah. But payment is not so good.
Yeah.
I have to survive. So I had to think another, job.
Yes.
In
Another
Japan.
means, because the salary in Japan as an athletic trainer was back then too. It wasn't as good as what it is now, or it was just kind of all new to Japan.
Yeah. Because actually now it's okay. But that I'm talking about like almost 20 years ago.
Yes.
So at the time, it's that was so hard to get the job in Japan as an athletic trainer. Yeah. So actually that was good for me.
Okay.
So if I got the good job opportunity in Japan as an athletic trainer in the sports scene, I've never think about another
Making your own company.
Right.
Exactly.
Yeah.
So then what happened after you were going through, being a traditional athletic trainer in a traditional setting? What made you decide, I'm going to try to make my own company?
Well, actually, I looked around like a fitness industry in Japan. That was good, but so that was good for diet, like lose weight, and get the muscle mass, and kind of refresh.
Yes.
Yeah, those three things, the main big,
The demand was there for those three, and then that was all that existed in Japan, and this was again like 20 years ago. Yeah.
But like the people who are in the fitness club in Japan is almost over 40 years old.
Okay.
Yeah. So most of people have like something wrong.
Yes.
Pain anywhere.
Yeah.
Yeah. If I ask people like, you were healthy? Okay. Most of people, but something.
There's always a injury or something even long time ago that they didn't take care of. Right?
Yeah.
Yes. Exactly.
Yeah. So most of people have some problem in their body.
Okay.
So that means they have to fix it.
Yes.
Through the exercise.
Yes.
But in fitness club, there's again that area is good for three big demand, right?
Yes.
Lose weight, get muscle mass, refresh.
Yes.
So the fitness class never think about like a functional like recovery. I mean, how do you say that?
Or functional movement.
I think,
because especially in that time, I would say a big shift in the trend was, instead of just your traditional weightlifting and strength and conditioning, it was switching into more functional type movements, meaning that it translated really well to activity or sport. And you were just in the very infant stages of that in Japan, because no one else was doing it.
No.
Right?
No.
Yes.
So that's why I request the fitness club in Japan. Okay, you guys should need that functional movement exercise in this area. Yeah, but they at the time they don't understand what I am talking about.
Yes.
What's a functional means? Like,
it was foreign. Yeah.
Yeah.
And to give people an idea, when did you start your company? What year?
It's 17 years ago.
2002?
2002, yes.
Yes.
Actually, 2003, I'm sorry, yeah.
2003.
Yeah.
Yeah, so, I mean, not only was it kind of picking up trend in the US, but in Japan, I don't think it was completely foreign. So then you had to take this concept that you learned primarily from the U.S., right?
Right.
Because
Yeah.
you follow Gary Gray a lot, right? Gray Cook a lot, and I think even for Gray Cook really started doing all of these things in like the mid 90s before he published his book and stuff.
Okay.
So it was still relatively new. I mean, if you think about it, 94, 95, I think is when he really started to publish more information about what he was working on. That's only like 9-10 years later that you were trying to do this in Japan, which is pretty amazing. Yeah. So what were some of the struggles and what was the history of the company as you grew it?
Like 2003, I set up the one facility.
Okay.
Yeah. So at the time, just only 2 clients.
2 clients. Okay. Yeah.
That was my startup.
Okay.
Yeah.
And how did those clients, did you know them?
Well, actually, just I didn't do any like publish. I mean, like kind of media.
You didn't advertise or anything.
No, nothing. So just word of mouth.
Okay.
Yeah.
Did you know them before they came to you, or no? That was the first time you met them. Okay.
But what I was doing is just I've been taking care of like a top athlete, Olympian.
Yes.
Yeah.
So that was kind of that was what was appealing to everybody, was that you were able to care for these athletes.
Yeah, but the general people never know about me, right?
Yeah, exactly.
Right.
Yeah. So what was the growth like? I mean, growing from 2 clients, how did you get from there 17 laters to having 3 facilities?
What I did is just I just focus on the result, like
okay.
Yeah. So people, again, like people who coming over to our body, they have something problem.
Yes.
Or they have like a clear goal.
Yeah.
Not like I want to lose a weight. So
Yes.
I just I don't know much about the fitness, but I just want to get sweat.
Yeah.
So those kind of people never come to.
It's not really your demographic, and I think like because the facility that I work at too, we're very similar. It's we're not saying that weight loss or healthy weight or aesthetics is not important, but that's not the primary reason as to why we're doing it. That might just come and fall into place when you do all of the other stuff, which is good, but it's not so much emphasis on aesthetics. It's more emphasis on performance, making sure your body moves how it's supposed to.
Right.
Yeah. So I mean, that's where I think you were able to build the results over time. And correct me if I'm wrong, but that helped the growth, right? And then made your facility busy and everything. And give a little background on what kinds of things you really focus on. Because I know we talk about this a lot, but just for some of the listeners out there, understanding what kinds of things we're actually looking at to help you perform better.
Well, I mean, like, again, like you said, I don't say lose weight is not important. I don't say that. It's so important.
Yes.
Also, strength training is so important.
Yes.
The classic quick lift. I love that.
Yes.
Yeah. So, furthermore, like a quick lifting is one of the best of functional training. Right?
Yes, exactly.
Yeah. So that's no argument. Like,
yeah.
So, but what I want to do in Japan is I want to expand the recognition of the athletic trainer in Japan. Yeah.
Okay.
Yeah.
Especially early on, that's what you wanted to do.
Right.
Yes.
Yeah. Because lots of general people don't know much about the fit. What's the difference between like a fitness instructor and athletic trainer?
Yes.
Yeah. So even though I can teach some the corrective exercises. People don't know much about what's a corrective exercise.
Yeah. Yes.
What's the difference between corrective exercise and like aerobic?
Yeah, exactly.
Right, exercise. So I just wanna do some like recognition of athletic trainer in Japan.
Okay.
So for that, so functional training or corrective exercise. It's good tool for that.
Got it.
Yeah.
Got it.
Yeah.
And I mean, how do the clients, and this is probably from day one since you started to today, how do the clients respond to that in Japan? Like what you call, so to clarify for people, corrective exercise or this foundation of movement that I constantly talk about on all my social media and everything, you call it conditioning.
Yeah. Yes.
Which is just basically, it's Gray Cook might call it movement minimums, but it's basically just the basic foundation of how you should move. And we need to really make sure that that's working well so that you can do all of the Olympic lifts or strength and conditioning or any other types of sports. But how do people respond to your conditioning approach, your clients?
Good question.
Yeah. Because that's the challenge, right?
Yes.
Is to get people to buy in to see the benefit, or buy in long enough to see tremendous benefit, and then they start to recognize that this is so important. Yeah.
Okay. So in Japan, there are a lot of how do you say, like acupuncture clinic, or like
a lot of what I like to call passive treatments, where you just lie down and you're getting treated. You're not doing anything actively. So probably acupuncture, massage therapists, chiropractors. Okay.
Then in Japan, there's a lot of good, awesome, passive treatment.
Yes, exactly.
Service guy, right? Yeah. So that's good things. But it's the people, it's knowing, okay, we have to do something after get massage.
Yes.
So people started knowing about this. Then I sent a message to them. Okay. Massage is good. Acupuncture is good.
Yes.
But after you get the passive range of motion, you have to get the active range of motion.
Yes.
Yeah.
Exactly.
Yeah.
And I think once they start to realize that, everything works together or they can function better, then I think they get to see the benefit. And again, that reinforces the results that you're trying to focus on. And it also gets them to keep doing this month after month, right? How many of your clients, whether they're professional athletes or just your average person, how many of them have been with you a long time? Do you have a lot of long-time customers?
Yes.
Yeah.
There's a lot of clients to come in our body over the 10 years.
Oh, yes, exactly.
Yeah.
And that's where I think we have a lot of good conversations, because at Performance Rehab Ortho too, we have a lot of clients that they've been here since the existence in 2009. Or we have quite a few that they've been here my whole time here. And this is 6 years in that I've been working here. So like, you see that it's becomes a part of their routine. It's not something like, oh, I just do this for 3 months and then I'm good. It's more like, no, this becomes part of your just overall body, taking care of your body. So that's really good. I mean, what other things do you think influence, I guess, your clients' results at your facility? Like, because let's talk about your staff, I guess, a little bit, because you have trained a wide range of people from all different backgrounds, right? Because you don't have too many athletic trainers at each location, but you have a lot of people that have become very knowledgeable in how to teach corrective exercises, how to work with the clients or patients, how to care for different injuries, different scenarios. So let's talk about your staff a little bit. How have you implemented this system at your facility?
Oh, actually, every year, over 500 like a student trainer apply our body.
Okay.
Yeah.
It's in high demand. Yeah.
So then I think it's maybe like about 10 people can get in our body each year.
Is that for an actual staff position?
Yes.
Okay.
Yes. Okay. So we have like it's kind of curriculum to educate the trainer.
And you've come up with majority of this.
Yeah, I'm one of them. So we have another master trainer here.
Okay.
Yeah. So then our curriculum is not like like teaching how to. It's one of the there's a lot of seminar showing lots of exercises how to do this.
Okay.
Yeah. But it's kind of one of the tip, right?
Yes.
Yeah. What we do is more authentic.
Okay.
Why that client have to do squat? What's the key point to the fix the movement, that kind of stuff. So what we do is we use just 30 exercises.
Okay.
Then with these 30 exercises, we have to think about the movement.
Yes.
More authentic.
Yes.
Stuff.
Okay.
Yeah.
And then how long does this staff training take? Or
15 years ago,
it
took about 6 months to 10 months.
Okay.
Yeah.
Okay.
Now it's just 1 month.
1 month, and then they go through all of this, and they're practicing it.
Yeah. I mean, after 1 month,
yes,
the trainer can get service to the guest.
Yes.
Yeah.
And good, and then they get that real life experience where you and I both know that's where you really start to learn how much you understand these concepts, because now you got to apply it on another person. Yeah.
Right.
But I just want to say, your curriculum and how you train your employees, it's not you telling them exactly how to practice, but you guys all start with the similar base knowledge, I guess, so that now there's cohesiveness in the clinic, so that every patient and every employee and everybody, they all kind of know what's going on. You guys are speaking the same language, you guys are looking at things in a similar way, yet you still have the ability to use your critical thinking skills to figure out how am I going to help this patient, because even though I have this knowledge, now you got to cater it to the patient. So I mean, that's something that I think has contributed a lot to why you have 3 clinics today, is because you get a lot of these professionals well trained, and you guys implement the services to help to get the results again, like how you said.
That's right. I think it's if I made that curriculum I made actually 15 years ago, our curriculum is like this. Okay, we have about 1,000 type of exercises.
Okay.
I want to memorize that.
Yes. Yeah.
Because this is a curriculum.
Yes.
Yeah. So I have to make the training program for each person. So I want you to memorize.
Yeah. So it wasn't so much thinking. It was just you have to memorize it.
Then what do you do? So you have to pick up some exercise for the one guest, and you have to make that program.
Yes.
This is our that was our program
before. Yeah.
Yeah. Before. So it took a long time to memorize, right? It's over the 1,000 exercises.
Yes.
Also, the people is so forgettable, so easy to forget.
Yes.
So that's why took a long time. Also, the quality is low.
Yes, because there's too many things, and then they cannot remember. And I agree, and But now, just 30 exercises that you guys really use as your core.
And also through those exercises, I want you to think about why, not how.
Yes.
Why use that squat to that client?
Yes.
What is the point? What's the procedure?
Exactly. Yeah.
But so once you get that, that's just one squat exercise.
Yes.
But if you got the knowledge of the thinking.
Yes, the logic and the philosophy.
Yeah.
Yes.
You can expand another exercise.
Exactly.
Through the squat.
Exactly. Yeah. And I think that's something that we've talked about too, is, figuring out how to make it super efficient, scaling that kind of system. And I on that note, I kind of want to touch on, I have never been to Our Body Project. Yeah, I still got to make it out
next
there.
Year.
One day, hopefully next year. Hopefully sometime when this is coming out, then I'll make it out to Japan.
Jeez.
But from all of the things that you have shown me, we've talked about before, and the discussions, you do a great job of individualizing the patient's experience. Because even though you have a core group of exercises, people might be thinking, oh, 30 exercises, that's not that many. But you guys still do a thorough assessment. I mean, we're both SFMA certified. You have altered that a little bit. You do a thorough assessment. You take, I believe, static posture pictures of front view, side view, back view. You're analyzing all of their anatomy trains, their fascial meridians. You're seeing how their static posture is. You're seeing how they move. Then you take a assessment every session, kind of seeing how are you progressing with this. So like, even though the 30 exercises may not seem like a lot, there's a lot of individualized programming and coaching with each patient or client every session. And I think that's what you're talking about now, is that, yeah, if you understand the concepts, you understand the logic, you can apply it to every individual, because every individual has different things going on, even though they might have the same diagnosis. You might all come in with shoulder pain, but this shoulder pain is different from this shoulder pain, is different from this shoulder pain. So I think that's something that you guys do very well at the facility, is that you do a thorough assessment and evaluation, and you're constantly trying to see what's going to make the most progress for that patient, and reassess and intervene, reassess. Yeah. But I mean, it's pretty amazing how big you guys are now, and you're even looking, we'll talk about that towards the end, but I think you're looking to expand further. So it's something that you've been kind of the forefront of conditioning or functional movement in Japan, and it's something that the regular population buys into, but also the elite athletes buy into this, and you take care of a lot of the athletes too. On that note, I want to kind of touch base a little bit on what is the healthcare industry like in Japan, because there are, I would say, quite a bit of differences than in the US. You know, let's just start there. Like, what is the healthcare like in Japan? And where are your facilities? Because that's interesting.
Okay.
Yeah.
Okay. So my facility is like, again, like you said, like, performance enhancement center, or like a conditioning center. That means like, what we are doing is bridging the gap between the medical and like a fitness center, like a like a medical and fitness. So conditioning in between that.
What is the medical industry like? Like how does a person, after they get injured, how do they go through the system to get treatment?
Oh, okay. It's like in Japan, there's like the insurance, government insurance.
Government insurance, yes.
So everybody have it.
Yes.
Most of people, right? So if you get injured, you can go to see a doctor, then with this insurance.
Okay.
Then if you have this, so the government covers 70%.
Okay.
Yeah. So that's good, right?
Yeah, that's good. Yeah.
Yeah. So that's why Japan doesn't have a culture of the injury prevention.
Got it.
Yeah.
Because the government covers insurance and everything.
Yeah. Then
really
with this insurance, we can get the good medical support.
Yes, good services.
So,
okay.
So people don't think about the before the injury.
Got it.
Yeah.
I think that's very similar in the US too, you know. So once they go see the doctor and stuff, how does physical therapy work? Because that's still in the medical side of it.
I think there's a big difference between Japan and the US. The physical therapists in Japan can work only inside a hospital.
Yes. Where in the US, I mean, as we all know, there's all different types of physical therapists that specialize in different fields, but there's a lot of outpatient clinics. And when we talk about physical therapy in the US, especially with orthopedics, it's all outpatient clinics. I mean, we have physical therapy services here, so we're not in the hospital, which is huge difference. So once they're in the hospital, I mean, we even talked about this before, but to briefly explain, like, when you get surgery or you're injured and you're in the hospital, what's the perception? Like, is it like you're healthy, or is it like, no, you got to stay in the hospital until you reach a certain cutoff?
once you when you get the surgery in hospital, like they have to get the PT service. So this is much longer than US.
Got it.
I think it's almost about a month.
About a month, and depending on the case. And
If you get like a ACL,
so they're in the hospital the whole month, or after whole month.
Yeah.
So they don't go home and come back like how we do.
No.
Okay.
Yeah.
So that shows you like how much the healthcare system or the medical system has to do, especially after a surgery.
Yeah.
Okay. So after they finish that 1 month, then what happens?
Then the hospital let them go.
Let them go. And then
just no like additional support.
No, So then, if they don't come to our body project, what do they do?
Nothing.
They try to do it on their own, right?
No. Yes, right. That's right.
On their own, or and then that's where it becomes. Yeah, that's where it becomes. I mean, even what we see in the U.S., when you try to do it on your own, it's not saying that you won't get better. It just might take a lot longer, right? Because you don't have the guidance.
Okay, so for the elite athlete, like a top athlete, can go like that facility after surgery, like a Olympic Center or National Training Center.
Yes.
So they can go there after rehab.
Yes.
But it's the general people. There's no place.
There's no place to go. And even in the U.S. too, I think what people don't realize is when we get orthopedic injuries, we see the athletes, college, pro athletes, and we wonder how do they get back so quickly? It's because they get to go to the athletic training room where they get to get care daily, and they're doing a lot of things in a short 6-month period, 9-month period that helps them to return. So this is where there's a lot of overlap, I guess, with our body project and Performance Rehab Ortho is we're bridging this gap between the medical side or physical therapy all the way to return to sport or return to just strength and conditioning. And I think that's an area that's very important because, again, it's setting up that foundation or kind of what you call like conditioning so that you can do all of the other things and not get hurt again.
Right.
Yeah.
That's right. So this area, not only athlete, also all the people,
everybody. Because you don't want to be stuck in a position where you get released from physical therapy, or in Japan you get released from the hospital. Then it's like, okay, what do I do now? How do I get stronger? Because you're not ready for unrestricted activity yet, and you don't want to live a quality of life where you're impeded or you're restricted by your strength or your range of motion or pain. Even you don't want to live in pain. So I think that's super important. Now after that, so if they do come to our body project, do some conditioning, or even if they just take extra time and try to do it on their own, what's the fitness side like in Japan? Do a lot of people go and work out at gyms? Do they work out at home?
Oh, half and half. Like a young generation goes to.
Is it like a facility?
Yeah.
Okay.
But it's not like 24 hours fitness. That like
got
that
it. It's like smaller facilities.
Yeah. It's like yoga studio, or it's kind of a group exercise studio, that kind of stuff.
Okay.
Young generation goes there
to stay active.
Yeah. But the elder people goes to like a fitness club. Yeah.
So I mean, that's pretty similar. I think even in the U.S., it's a lot of people that do like to train at facilities, but a lot of people that might go to the smaller classes or do other activities that help you stay fit. And now, when you think about that, what would you say is like, how well do people move in Japan? In your perspective, because I will share my take on this, but in your perspective, how do people move in Japan? Like, are there a growing rate of orthopedic type injuries, or no? For the most part, it's not that bad.
It's growing.
It's growing.
Yeah, for sure.
Why do you think it is?
Because Japan is the most. How do you say? Like in Japan, the age.
Age is growing.
Age is growing.
The older population is getting bigger.
Yes.
Okay.
That's why. Yeah, that's the big reason.
You're seeing like more of the older age movement issues, maybe arthritis, things like that set in. And even in the US, I mean, that's one of the big concern in the next 20 years or so, is that the older population is living longer, getting older, and you know, there's already a lot of movement issues because we sit a lot in society and all of these kind of things. But kind of going back on how people move in Japan, I mean, do a lot of your clients, when they come in, do they move pretty well? Or
I think so.
Okay.
I think so.
Yeah.
Actually, let me back onto that topic. Like in Japan, so like 10 years ago, government is focused on like obesity.
Okay.
Yeah, because obesity is, you know, is highly relationship to the
all the diseases, chronic illnesses.
Right.
But are there? I mean, I know obesity is growing worldwide, but the obesity in Japan, I mean, is it like really significant, you think, or no, less than like a fifth of the population, maybe?
Oh, I think it's getting, you know, food culture is changing.
Yes.
That's why it's obesity in Japan
is growing.
Yeah, it's growing. But I want to say, so that's why government is focused on obesity.
Okay.
You know, about 10 years ago.
Okay.
But I'm saying before obesity,
the
people get something wrong on the
before,
arthritis issue things.
Yes.
You know, people get something pain on knee, lower back. That's why they stop doing some exercises, walking. That's why they get obesity.
Yes, and then that leads or fuels the obesity problem because you start to gain weight, you start to become less active, more sedentary. So that's another great point. I mean, why conditioning, and you know, people have to have that preventative mindset. Like I gotta be able to move well, and then move, you know, keep that movement going so that I can do those activities, stay healthy, stay fit, and not get obese. Because once you get more problems, right, your knees sore, your back sore, now you're overweight, now your knees more sore, that's really what fuels kind of the quality of your life starts to go down. But that's exactly right. On that note, though, I wanted to kind of share my 2 cents on this, is that, so when I went to Japan probably a few years ago, the thing that shocks me is that, I mean, when you're going on the trains, you know, you're walking around, there's so much movement. Like people walk all the time. They walk everywhere. The culture is different. And honestly, when I'm out and about, you know, I don't think I see that many obese people. It's very different than the US.
Okay.
Because I think the lifestyle is very different. Like you're walking way more. You're doing a lot more things that are more active.
Okay. So when did you go in Japan?
I think this was, I can't even remember, all the years blend together, but I
Tokyo?
think it was, Tokyo 2017 or 2016,
Okay. So you see a lot of people use like, you know, train and subway, right?
Yes.
But it's just only in like a main area, like
in
Tokyo.
the big city.
Yeah.
Okay.
But if you go see outside of Tokyo,
then it's more like US.
Yeah.
And I think that's what it is. It's like, I was kind of thinking to myself too, maybe I'm just not seeing all of the people that are not active, right? But I think like for at least a big city, that's something that's big in influencing how well they maintain health, movement, fitness, is because they're moving around so much. It does help. And maybe, I don't know, maybe there's more like healthy options to eat in the city. Maybe they're more access to all of the resources because you guys are in Tokyo, right? So I mean, you have facilities like this that are accessible where people like to go to, and in the, you know, more the rural areas, there's not as much facilities or things like this to help people keep people healthy. So that's something about the culture that I thought was really unique, is that, you know, a lot of people move pretty well. I mean, overall their posture, I was like, their posture, in my opinion, and I'm born and raised in Hawaii. In my opinion, I was like, their posture is way better than anybody I see in the clinic. A lot of them. And that was kind of shocking to me, is because, you know, just the overall lifestyle and how they do things on a daily basis, that helps a lot. Kind of on that note too, I mean, even like Japanese, you know, you guys sit on the ground. Sometimes you guys lie down on the ground, you know, because like you do a lot of things sitting like either Indian style or sitting on your heels and everything. I think that helps to keep some of the mobility going. Where like
I think so.
in America, I mean, we find the best way to make the chair the most comfortable where you don't have to move anything, you know. And then I think that's part of the problem too, is that there's not as many things ergonomically like that in Japan, you know. It's
that's a good point. I think that's why the kids in Japan changing. They don't sit on the floor.
They're starting to sit on like chairs.
That's why their mobility is so
low.
Much lower than our age.
Yes, and I think that's something to take into note. That's a cultural influence, because they're maybe picking up Western culture or whatever it is, but it affects daily movement. And when you start to do that, you're getting all those problems like we talked about, and then maybe leading into health issues or overweight issues. But that's something that I just noticed when I was there, is that the way that people move is still a lot different than the way we move in America or the US. And because of that, you see it's very clear that it's represented with how people are moving in public. So I mean, that's something very interesting, and I think that's why you guys have done really well in the city, is because there's a lot of people that you guys can help to maintain proper movement and everything. I know that you're busy on vacation and everything, but we'll kind of slowly wrap this up. This was some good conversations, but
how to improve like quality of life is depends on the person. Like, some people like yoga. It might be good for a QOL or strength training.
Yes,
but some people might be reading or watching a movie.
And improves the quality of their life. Yeah.
So I want to say is to get improved quality of life is it's different kinds.
Different for everybody. Yes.
But you cannot replace your body. Your body is going to.
You only have one body.
One body.
Yes.
So you have to replace it. You cannot do it.
Yes.
So what you have to do, no matter what kind of QOL you want, but you have to keep your body healthy.
Yes, healthy. And I completely agree. I think when you don't take care of your body, that's when, no matter what you like to do, the quality of life is going to go down. Yes. And that's where I think our philosophies are very, very similar, because that's why we do what we do. It doesn't matter if you're training for the Olympics, if you're one of professional athletes, or if you're just someone that's starting to exercise. The bottom line is the same. We're all moved very similarly. You got to figure out how to get back to normal movement, functional movement, and we got to learn how to take care of our bodies so that we can improve the quality of our life. Yes.
That's why I want people switch the mind. Like doing some exercises is not just for fitness.
Yes.
Might be it's for your reading a book.
Yes, exactly.
So exercises is not for fitness. Not only for fitness, also for
everything.
Conditioning, injury prevention, to keep healthy your movement and body. So so reading a book correctly is you cannot do reading a book without healthy body, right?
That's kind of true. Or even just like a lot of times people forget, and as I talked to you about this too, I do a lot of nutrition coaching, sports nutrition, but even just your clarity, like mental clarity, that is part of overall health. Because I mean, it might be physically posture, you don't want to get sore from reading a book and all of this, but if you cannot even focus, which is overall health, mental health, then I mean, you can't even read a book and enjoy it or comprehend or follow along. So exactly, I think everything that we do encompasses
right.
kind of improving the quality of our health. Yeah.
That's why. So I want like I want people like changing the mind.
Yes.
Change the mind and think about the what the exercise is.
Yes.
It's for your, happiness. I mean, like
happiness. Yeah.
The fundamental of happiness.
Yes,
right?
Exactly. And it should be a priority in everybody's life to incorporate some form of exercise and taking care of your body.
Right.
Yeah. No, that's a great message, and I mean, yes.
Yeah. Also, 2020 Olympic is coming over next year.
Yes.
In Tokyo.
Yes, in Tokyo.
So then, so Japan has an Olympic legacy. Yeah. I think it's I think it's conditioning is one of that.
Okay.
Yeah. So injury prevention.
Yes.
Yeah. Training for injury prevention is one of like Olympic legacy in Tokyo Olympic, I think.
Oh, that's good.
So that's why after the Olympic, maybe the culture of conditioning is expanding to the general people.
Yes.
Yeah.
And I think that's gonna. I actually personally think that's gonna catch on a lot in the next 5 or 10 years, because you don't want to get to the point like you said. You don't want to be injured with something that could have been prevented.
Right.
And then enter the healthcare system like that. I'm not saying, like, I'm a big proponent of the healthcare system. I think technology and procedures and everything have come a long way, even from when I grew up, right? But at the same time, there's lack of emphasis on the prevention side, injury prevention and conditioning. So that's really what I think the shift is going to be. Is that there's going to be a lot more emphasis on that, so that we keep people healthy. And still there's the medical side. That's very important. But we have a lot of people doing things to keep themselves healthy and improving their overall happiness and quality of life.
I think as athlete is one of the specialists of injury prevention training.
Yes, exactly.
Yeah. So that's why, the Olympic legacy, that's my belief. Like, I believe like, conditioning would be the Olympic legacy.
Yes.
For that. Yeah.
Yes, definitely. Yes. Before we wrap up, so one thing, why don't you tell us a little bit, whatever you want to share, but tell us a little bit about where Our Body Project is going, what kinds of things you have looking forward to, and then, maybe people, I do know that your website, you have the English translation, so people can go check it out. What's your website, and what are some of the things that you're working on?
Okay. Again, please come over to Japan next year. 2020 Olympic is coming.
Yes.
So then after that, please stop by our facility.
Yes, I will. Anytime I'm in Japan, I will stop by your facility. Yeah.
Then also, now we have 3 facilities in Japan. I mean, Our Body has 3 facilities.
Okay.
So people want interest in the Our Body facility. If people want to be the owner of the Our Body, please call me.
Oh yeah.
So our core competency is the system, an educational system, an operational system.
Yes.
Yeah. So we can deliver to all over the world.
Yes.
Yeah.
So you're looking to franchise it out because you have the training, the staff requirements, facility requirements, and that's super exciting, and you get to see more of how you guys treat patients and everything, and hopefully it grows outside of Japan.
Yeah.
Anything else that you're looking forward to? I know you're always busy flying all over the place, and
I love Hawaii anyway.
Yeah.
No, what kind of business we can get in Hawaii. I want to come back again.
Yes, you're always coming back and always keeping in touch and sharing some of the great things that you're doing, and then vice versa. I get to talk to you about some of the things that we're doing over here too. So it's been always a pleasure talking with you and everything, and it's super fun to share some of the similarities and differences when it comes to training philosophy and what we're doing. I don't even know how far away Japan is, but all the way across the Pacific Ocean. It's very unique that we're both doing very similar things in different places. Overall, thank you so much for taking some time with us.
Thank you so much too.
And I want everyone to check out ourbodyproject.com. I will have it up in the show notes, and you guys can take a look at some of the things that they're doing. Also, next time you come back to Hawaii, we'll be sure to connect again and maybe do another conversation and share some of the updates of what you're doing. And I guess by then, hopefully we'll be able to talk about the 2020 Olympics, which you are one of the medical advisors for, which that's a huge event that you have to oversee. So I wish you all the best of luck with that.
Thanks.
And hopefully it goes well. But anyway, thank you again for joining us.
Thank you.
This was a great conversation.